We're here.
Hi. Okay,
Look at
I'm gonna
that.
turn off. Hi, Lindsay. Hi, Mama. Let me just turn off comments just so we can have it just between you and I just for a
Okay,
little bit.
absolutely.
And
Uh,
then we'll get into it because I know people are going to want to ask a bunch of questions. So I'm
all right.
excited about that. It's going to get
So
crazy.
I feel like when I was reading your book, there were so many like commonalities of my perspective in my book and your perspective. Yours is just is a great like general rules of life about how to like stir the pot in the other direction. And it's so funny because when people don't get that, um, you and I get that, but get that across to people who aren't ready to kind of like re-stir things up.
Well, for me, I would say I was not ready for so long. I was not
Really?
ready. I was the same. I really spent most of my life growing up assuming that it was always on the outside and it always was a circumstance of somebody doing something to me or
Yeah.
you made me feel.
Really?
All of my feelings were externalized.
Right.
You made me feel ugly, or
Yeah.
you made me feel bad, or you made me angry.
Yeah.
And when I started to realize was the same things that I was quote unquote feeling or somebody was making me feel like was the common thread was me, no matter what the
Always.
circumstances. So
Always.
everyone changed around me, but it was the same thing over and over. And
Yes.
I'm just a seeker in general. So solutions in general, I'm like, just give me the answer. Just like
Yeah.
send me to
Yeah.
the therapist or the doctor. Like I try to go to the best. If I can do it, I go to the
Yeah.
best.
Yeah. Yeah.
So
Yeah. Yeah.
I was seeking and I was like, I need to figure this out in terms of, I know that I would have these conversations with my mom in the book. I would have these conversations and I would tell her and I would lay out all the evidence of why I was right. And she would say at the end of every conversation, I know you think this is about X. Like, I know you think
Right.
this is about
Yeah.
whomever,
Yeah.
but I promise you this is about you. So that being said, I think that what you were saying before about you're talking about beauty in your book, but
Yeah.
I could not believe how much it mirrored the method
Yeah.
in terms of you expect and treat people on a level of their what's going on the internal world, because
Right.
so many doctors I've seen will just
Yeah. Yeah. Yeah.
do whatever you request.
I'm
And
just a
for
piece of the
you,
puzzle.
yeah,
I'm just a piece of the puzzle. And it is an important piece because we are visual people. We can't help it. And no matter how much we work and exercise and diet and try and take care of ourselves, self-care, we weren't meant to live probably past 40 years old anyway. So I'm certainly a part, but it's, without all the other stuff, my stuff doesn't work. And I think that's
it
kind of,
won't work.
it won't work.
It can't.
It can't.
No amount, like I was thinking about it. I was like, oh, what's a way I could say it? No amount of filler can
No,
fill your
no,
soul.
no.
No
And
amount
that's
of filler can fill that up. We are probably one of the only people that are talking about the duality of internal work and
absolutely.
external beauty.
Yeah.
So
You know,
that's really like what I find so fascinating, how they're so closely correlated.
yeah.
And we think that they're separate. And one
No.
of the parts that I loved in you should have seen me with your book. I'm going to do a swipe up, but please buy this book. It is not about, it's about beauty, but it's about so much more.
Yeah.
But one of the things that I really loved in your book was when you were talking, and I hadn't even realized that I had and like a perception of this, but you were talking about wellness and you were talking about beauty and the idea that people have marketed it as something to do with vanity and it's
Yeah.
perceived as
Yeah.
selfish
That they're evil. You're narcissistic.
or that you're bad. Yeah, exactly. And I thought that that was a really powerful thing because
Yeah.
I remember when I first started doing Botox,
Yeah.
I thought that that thing was I still do. I
Yeah.
think it's the craziest, coolest medicine in the world. And I remember telling everyone,
Yeah.
and people were like shocked that I would say it. And I'm like, no, 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 you have to try it. And I was speaking about it like it was a new lip gloss. And I know
Yeah.
it's different, but for me, it was
Yeah.
just like, oh my gosh, people ask me all the time. They're like, oh, what's your favorite beauty product? And I'm like, besides Botox, Yeah,
Yeah,
because that's
exactly.
why
Well,
I really,
that's exactly
for
it.
me,
It's like a
for
form of
me, and it's
grooming.
not, it doesn't
Absolutely.
change my, like, my face is my face. That doesn't do anything. I just
Yeah.
don't love seeing when I
Yeah.
get angry, or if I get frustrated. Like, I have resting bitch face. No matter what I do, somebody is always going to come over to me and be like, "Are you okay?" And I'm like, "No, that's just my face. That is just my face." So
I
I
don't
remember
believe that.
I no, trust me. So when I started doing Botox, I would talk to people about it, and it seemed like it was taboo, and women were not talking
Yeah.
about it, and they're
Yeah.
thinking about it as it's like some separate element. And I'm like, no, this is just, I
Yeah.
feel great with it. I'd probably feel fine without it. It's
Yeah.
just a little tweak and it makes me great. A core principle of the shift stir method is owning your awful.
Absolutely.
I don't
Absolutely.
know if I'm
And you
getting,
know what?
own your
I,
awful. And my awful is quote unquote,
yeah.
I'll do Botox or a laser or whatever. And I don't
Yeah.
consider that awful.
No,
I
it
just
makes
was
you
kind of
feel good.
trained, and yeah, I was like, oh, like this is something that I like. And I just didn't even know that there was that perception out there in terms
Yeah.
of taking care of yourself. Like, this is
Yeah.
a part of my arsenal. I go to the gym, I go to this, I do that. It's something that I'm like, yeah, it's great. But I do understand that people have a perception, because we have seen it go so far on the other end where people
Yes.
get bad everything. Like,
Absolutely. You
let's
only
say,
notice the bad work. You
yeah,
only
we
notice
only
the
notice
bad
the
work.
bad work because
Exactly.
nobody's really talking about
Yeah.
the
Yeah.
regular work, because you're just like, oh,
Yeah.
she looks great, or
Yeah.
whatever it is. But one of the lines that you said in there is, you were talking about how beauty is when somebody comes into your office, that from 8 o'clock in the morning till 6 p.m. you're on stage.
Yes.
And what I inferred from what you were saying was, when people are like, I want to look like you look amazing, you look so young, they're not only looking to you as, oh, you look so amazing, but there's that wellness and that
Yeah.
the well of vitality that
Mojo.
comes with taking care.
Yeah.
Yeah, taking care of inside in your mind,
Yeah.
of like, oh,
Absolutely.
there I go, I see myself thinking that way, and thinking, harshly about myself, or
Yeah.
whatever it is. That's what they're looking for. And I think when you do this work, no matter what happens on the outside, if you change it or you don't change it, it's not necessary. It's like a little bump, but it's not coming from that need
Yeah.
perspective that, like, that's going to fill me up or make me feel
Yeah.
like a different person. I just think it's a little tweak goes a long
Yeah.
way.
People will come to me and they'll think, well, what are you doing? What treatments are you doing, Dr. Frank? All these things. And I always have to say, it takes a lot of work to be me. I'm not easy. You know what I
Yeah.
mean? And I struggle just like everybody else, but I'm committed to being the best version of me. And sure, I'm doing procedures, but I always like to communicate with people, the exercise, the nutrition, the psychology, the meditation, the things go through it. You mentioned how you shifted. For me, what shifted my thinking is when I started doing transcendental meditation about 7.5, 8 years ago. That's when really it's like,
Same.
yeah,
TM.
TM did for
I
me what
love
your mom
TM.
did for you. Just like, it's not about
Yes.
the rest of the world. It's about you, you know? And
Yes.
as once you get a hold on that, the world will see you differently. And it'll be a positive feedback mechanism that works in your favor. And that's why I still commit to twice a day, every day. In fact, I meditated right before I spoke to you.
Good for you.
Uh,
It's an amazing, and it's it's like a recipe. There are so many ingredients that
yeah.
make that full, flavorful Tinamarie.
And it's
Like,
work. It's work.
yeah, it's work. It's like, okay, I
Yeah.
get my nails done. I get I
Yeah.
whiten my teeth. I
Yeah.
will, I do Sakara Life. I wear
Yeah.
whatever beauty products. I love
Yeah.
that. But this is a part of how I feel like I best show up in the world.
Yeah.
And I feel confident and I feel good. And I think that there's this, especially with like this new age self-love movement, it
Yeah.
really, like, I think sometimes it gets demonized about
Absolutely.
self-love and
Yeah.
self-care, that it alters and it becomes like a source of shame, or
Yeah.
something that is not perceived as empowering. And I'm like, no,
Yeah.
no, that's empowering to
Yeah,
me.
it's
That makes me feel
empowering.
really good.
Uh, the good news is that the younger generation now do view a lot of these type of things as a form of grooming. So they are changing the way we're thinking about rejuvenation. As I'm not a plastic surgeon, I'm not really changing the way people are looking. I'm trying to like rejuvenate them to the way they once did, the same way you exercise to have your muscles the way they were when you're younger, or you
Yeah.
try and maintain your weight. And I find the younger generation really views it as one category. And a lot of the stigma is really going away. And what it's doing is it's driving the technology, the laser companies, the injectable companies, to create technologies that fit into this form of grooming that are like less downtime. They focus on the health of your skin, not just the way you look. And they're working on younger generations where you can do little things to prevent the big needs in the future.
Yes. Oh,
Yeah.
I completely agree. So the way that I describe like my rationale for Botox is I say
Your rationale.
my rationale, like if I'm talking about it, because I was talking to a friend earlier and I was like, uh, I consider my skin like origami.
Yeah.
So if I fold a piece of paper up one time and I
Right.
open it up, say a Post-it note, I make it a little swan and I
Right.
open it up and I folded it once. It's like, oh, the creases are light. But if after the 100th fold, I open that swan up,
Oh.
it looks like
Oh yeah.
the Grand Canyon up in there.
Yeah. Yeah. Yeah.
It looks no joke. So when I have the ability to, as you know, it's a what is it, neurotoxin? It's
It's
going
a
to,
it's a muscle relaxant. It's a muscle
yeah,
relaxant.
it
Yeah.
relaxes the
Yeah.
muscles and it allows that to not be going up and down. And I'm like, wait, that's just reduce. I call it harm reduction.
Yeah.
It's
It
like
is.
it's harm reduction, so I don't have to
Yeah.
keep on folding that accordion and that
Yeah.
origami. And I don't.
Yeah.
And so that being said, I just found that modern medicine, especially now, like that's brilliant, and people couldn't have there was nothing
I know.
before that was like that. It just was
What
they
people
didn't
don't
have that.
realize.
So even the advancements, and what I also liked about your book was you went and did a deep dive on all the things that I am just curious about, just because I'm into all this stuff. Like I should have
Right.
been, I should have like gone into this or something, like micro needling, who you want to get it done by, what are the side effects, what's the downtime,
Yeah.
different laser resurfacing, chemical peels, the side effects, how long is it going to last, things to avoid, like all of the things that we're all curious about other people getting or what we want to get,
Yeah.
you can know about it and understand what is good. So I thought that
It,
that was
it's
really
so
cool.
it's the Wild West out there a little bit. So a lot of people, the good news is that so many different types of people are getting these things done now. The bad news is people don't know where to go. People don't know who's qualified. Obviously, there's a lot of money in it, so pigeons go where the crumbs are. And it can be dangerous for consumers out there who don't have good word of mouth referrals and things of that nature. So it's really important because, again, people think of cosmetic rejuvenation. They only think of the bad work. They don't think of the
Because they don't
people.
know that
They
the
don't know.
people walking around, like
Yeah.
you would never look at me or and
No.
I
No,
just
no,
think
no.
that's the
Or
truth.
me.
Like you would
Yeah,
never be
same
like,
thing.
oh, that looks weird, because I would never do any.
No.
I don't want to look different. I just
No.
want to look like myself.
Yeah, you
And
just want to look like yourself.
I just want to look like myself.
Yeah.
So I think that that's fascinating to go through that, and really, like you said about the crumbs, you really have the luxury in your business and the way that you've built your business. You have the luxury of having that quality of consumer, I would say,
Yeah.
because you're willing to say no. And
They're an
most people are
educated
not willing
consumer.
to say no. You're
It's the
willing to
most
say
important thing.
that's not for you. Like I know
Yeah.
you want to do those
Yeah.
Kylie Jenner lips, but that's not for your face. That's not for you. Like
Yeah.
I get it. We can go in between, but I'm not having you walk around like that. So I think that that's important in your
No.
practice. You really have that eye for people. And I guess
Yeah.
I know that some people want it
Aesthetic.
extreme and whatever, but you're not going to do something
Yeah.
reckless.
Absolutely. Absolutely. And it's different in different parts of the country. People want different things. It's important, the doctor-patient relationship is the
True.
most important thing. It is
Yeah,
just
the
the most
stuff in
important thing.
LA. oh my gosh, those
I know.
doctors, I look at
I
them,
know.
I'm so fascinated. I'm moved
It's a
by
little
it.
crazy.
I watch all of them, but I'm
I
like,
know.
that is just a different, it's like in Texas, Miami, LA, New York, everybody has, and I think New York really has represented like a softer, more like it's just a
Natural.
more natural and soft
Yeah.
look. So we're lucky that we get to enjoy
I
that and even
say,
like that.
I say people in some parts of the country go to a doctor and they say who they want to look like. In New York, people come and say who they don't want to look like.
It's so true. That's good. Oh, that's so good. They're like, no, 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 don't do that.
No, no. People don't want to look like they've had anything done. It's about the doctor-patient relationship. I say in my book, I don't claim to be the best cosmetic dermatologist in the world. You have to find someone you vibe with. And it's true of any relationship in your life. The people that
Amen.
give you nutritional information, the people that, the friends you surround yourself by, the
I'm
people
just,
you
yeah,
exercise with.
hold on.
These are all such important factors.
Yeah, there was one part where I was like, you were talking about the correlation with the ego and pro beauty,
Yeah,
about, taking handle of the ego and how it destroys things. And I don't know, hold on, sorry. Pro aging is harnessing the power of all the components of your existence, the way you look, the way you feel, your health and well-being, and your sense of self, your relationship, to control your ego so you can be the best version of yourself.
yeah,
And having the words ego and beauty in that conversation,
yeah.
just people don't, it seems like it's in a different category.
I
And for
know, I
me,
know.
it's so important because we were on the call yesterday, and my favorite quote is, or one of my favorite quotes is by Gary Zukav. And he says, wherever you go, there you are.
Yeah, it's a great
And
one.
you mirror that in your book
Yeah,
because you're
yeah,
basically saying, no matter what I do on your surface, if your inside isn't right,
absolutely,
it's not gonna do
absolutely.
anything. You have to
Yeah,
do the inner work to be able to feel the benefits of it. And
yeah,
yeah, maybe somebody's like, oh yeah, you could say that from, being pretty or whatever, or being a model. But I'm like, no, no, no. I felt,
no,
even when I had the exterior, my insides just felt
yeah,
ugly. And
yeah.
because
Well,
I felt stupid or less than or
yeah,
poor or
yeah,
whatever it was that just got in my way, that I could never
yeah,
even feel my beauty
yeah,
because I didn't feel good about me. So
yeah,
I couldn't see any of that. So
yeah, yeah, yeah,
it doesn't matter what is going on the outside if you're not attending to the inside. And I think
yeah.
once I started getting that, I was able to appreciate anything that I did have that
Then
was
you got even more beautiful.
I'm telling you, I
I
don't know if
know,
it's
I know.
women. I don't know if it's like a certain age or if it's confidence at a certain age, but
Yeah,
I'm telling you, I feel better at my age
yeah,
now. I
yeah.
would not go back to my 20-something-year-old skin. I just
Right.
wouldn't.
Yeah,
Not
yeah, yeah,
because it doesn't look right. I just wouldn't
yeah,
want to go back to that girl because she was
yeah,
suffering and just
yeah.
so pained and was stirring over everything.
That's
So
what
I would
20 year
never
olds
go back
do.
there. So I like that age.
I know. Well, you know what?
Yes. Yeah, but
So
I had to unwind that.
yeah, so much when I read the shift stir method, so much of aging has to do, like I keep trying to tell people, you have to change the way you think about aging. We're sold anti-aging. Everything is marketing against it. Aging's a bad thing. If you go back 200 years, the thought of living to 50 years old is a
It's
blessing.
a dream. It's
It's
a
a
dream.
dream.
It's
And
a dream.
the fact that we have technology to not only keep us alive, but to make us feel good about ourselves at any age. I mean, you don't have to be so concerned about beauty. Everyone has a version of a good hair day. Everybody.
Everyone.
No,
Yep.
everyone knows when they're a little off. I don't care. Everyone who can see in the mirror has something that may bother them or something that they feel good about. And people deserve to feel good about themselves. They just have to unwrap their mind around the word anti-aging. And if you start off from blessings, the
Yes.
rest is cake.
Amen.
The re-
That's
the
that's with anything
I
when we
know.
shift into that gratitude mentality of like, oh yeah, that's that,
Yeah.
but I have this, or even just like taking inventory. of our
Yeah.
blessings. And, you
I'm
know,
good.
I have, like, my girlfriends used to call me the Long Island because my butt is non-existent. Like, gone, evaporated, evaporated.
There are
Okay.
injections for
No
that.
butt, no butt. And no, I remember being so debilitated, and I wish that I did. And I just was like, oh, this. And a part of it for me was, you know, the own you're awful. I'm like, that's
Right.
just not going to be me. Like,
Right.
I like my boobs. I got a cute waist. Like, you're not going to have it all. I'm never going to have it. Like, I'm not going to be the girl with the butt. Like,
Right.
I'm like, okay, I have cute cheekbones. I'll take it. Like,
Yeah. Yeah.
there's a trade-off.
Right.
And
Right. Right.
knowing that and owning that and
Yeah.
still being able to be like, yeah, I'm really confident in my body. I would
Yeah.
love for myself to have been, you know, I wish I had been born with a, you know, a bubble butt, but it just
But
wasn't in the
everybody
cards.
has this.
Yeah.
Everybody
And
has
that's
this. Yeah.
universal.
I have like Victoria's Secret models and famous models that come in and they feel ugly. And I
Yeah,
have
it's
people,
that, like, I had to really shift the butt thing.
you have to
I had
shift.
to. I was like, girl, you are not doing that. You have to shift that. You
Yeah.
are not going to be embarrassed. I remember I would be like at a modeling shoot and we would be backstage and all the other models were there. And I remember like putting on my like garment, like with my butt to the back because I didn't want anybody to see it.
Yeah. Yeah. Yeah.
And I'm like, now it's like the jig is up. Yep. That's my butt.
I know.
Yep.
But you know
It is
what?
what it is.
I
Like,
have I have 70-year-old men and women who feel very sexy also. It's not about age, it's about what's going on in here.
but I feel like as I grew older, I grew more confident in what I was. That's why I see aging as like it just keeps getting better for me.
Yes.
So I
Yeah.
see age that way. I'm like, oh,
Yeah.
like if you get more comfortable in your skin and I'm ready to age because I
Yeah.
feel I feel like a brand new person in
Yeah.
comparison to my 20s. I was
Yeah.
ripping and roaring and struggling and pained and causing other people pain. The last thing I want to do is go back to that mindset. So if
Yeah.
that means that I age, then age for me has been like pro.
I know.
Like it's
Yeah.
been pro aging.
Yeah.
Like
Yeah.
I'm all about aging in
It
that
just takes
respect
more work.
because yes. Oh, absolutely. It's yeah.
That's
But
it.
I also think you can have like you were talking about in your book about highlighting your features,
Yeah. That's right.
like your things, your assets.
That's
So
right.
like when
That's
you
right.
look at someone's face, like maybe they don't have the chin projection
Yeah.
or they don't have and I love looking at those before and afters. Those are my favorite. If anybody watching, if you want to see some major stuff, watch before and afters or Google before and afters for chin projection.
Oh my
Because
God.
it's a game changer.
I just did that. I just did that yesterday. I posted a before and after chin.
You did? No,
I
I'm
did.
shocked. They did one with Angelina Jolie where
Yeah.
they like pulled her chin back, and I was like, somebody can change their world the way that sadly the way that the world interacts with them based upon
Yeah.
a chin. A
I
chin.
know.
That's a
Just a damn
big,
chin.
big difference. A projection of her chin. Like it's absolutely amazing. So I just think if that's going to change your world and that's going to make you feel confident and
Yeah.
it's something simple and you have beautiful eyes and you have great cheekbones, but you can't figure out the chin part, just like I can't figure out my butt part. I'm
That's
not
right.
doing injections because I can't keep up with it because you're going to need a lot of filler for that.
That's a lot. I call that's the Birkin bag of filler. That's what we call the Birkin bag of filler
exactly.
right there.
Like I can't do that. But with the chin thing, I was really impressed. So, Paul, I want to open this up because I know that so many of my friends are on here because they want to talk to a doctor about, in general, about these questions, about what they can do, and I'm really excited.
Let's see.
Okay, so I'm going to turn on comments. So, do we have any questions for Dr. Paul? Let's see here. Hi, guys.
Hey, Livbug. Hey, Olivia. We're getting
Okay, so actually,
weird.
I'll ask you. Well, I'll give you a little. I'm
starter.
gonna ask my personal question. Yeah. Give you a start. For hyperpigmentation, yeah. I've had hyperpigmentation on my chin before, or I still do because I had acne breakouts. I didn't know what was going on. Oh, what's the name of his book? Sorry, the Pro Acting Playbook. But I'm gonna
Pro
do
aging.
I'm gonna give you guys a swipe up and you can get this because it's absolutely amazing. And he talks about all the things that we're gonna talk about. How good is microneedling? But we'll go back, sorry, for hyperpigmentation, and then we'll go to the microneedling.
Yeah, so hyperpigmentation, there are a lot of different things that cause hyperpigmentation, old acne scars, melasma from hormones, um, or just sunspots. The good news is there are a lot of lasers. There's not just one, unfortunately, that does everything. But the number one thing is, the sun. I mean, the sun, anytime you have hyperpigmentation, the only way you're going to get it better is by at least keeping it out of the sun. And then you can start with topical agents and start getting into some of the lasers. And what's great is now we have technologies that even work for the darkest of skin tones, because African Americans, Hispanics, people with darker skin tones seem to suffer from the hyperpigmentation the most. So there is a lot of great options out there for people.
Amazing. So, so laser, let's just talk about that. What is your favorite laser right now in general? Or you could say two, that you're like, this
Yeah.
is the coolest laser, like for anyone
Listen,
at any time.
new,
Where you're like, this
new is,
just cool, does cool stuff.
yeah, new is not always the best. And the Fraxel laser
Okay,
is
actually,
still
what's your favorite?
Fraxel. Fraxel laser is the
Oh,
best. I
no.
have I have 30 different lasers in my office, and the Fraxel laser, it's a 12-year, 15-year-old technology. It is still the workhorse. There's no one over the age of 30 who can't benefit from getting rid of sun damage, improving texture, reducing acne scars. It just works. And
No, I
based on
saw
some would
the
say,
craziest, sorry.
no, go ahead.
I saw the craziest before and after of Chelsea Handler. If you want to know what Fraxel
I
is,
saw that. I
I'm
saw that.
telling you, look up that before and after because it's like, and I say this in a joking way because she's a
Yeah,
comedian, but she like
yeah,
looked like a 1980s Louis Vuitton bag at
yeah,
first,
yeah.
and then she looked like a baby's butt. Like
I know.
her skin looked
I know.
epic. And
She
she
did it
even
rather
says it, so I'm
strong.
not making fun. She really,
Yeah. She did a strong version
yes,
of
but
that.
hers wasn't. She did. I mean, but I have seen different versions of that, so
Oh,
I'm
yeah.
happy that you say that it is older, but it's like the tried and true. If you really want, like the Grand Poobah of
Of
like all
lasers.
of that all at
That's it.
once, you're doing Fraxel.
But there are
Okay, so
a
let's
lot,
see. How do you control?
maskne.
Oh, sorry.
Maskne.
What's maskne? Oh! Is it
Maskne
mask? Oh, sorry.
from wearing the mask.
Sorry. Takes me a little late on that one.
I
Sorry.
know.
Sorry.
No.
Okay, so acne from a mask. What do you say
Yeah.
about that?
I mean, people are breaking out a lot because of the pressure and the collection of oils and lack of
And
aeration of the
moisture.
mask.
My hot breath. I could imagine just
I
having
know.
like anything that
I
was
know.
on your mouth, like
Yeah.
even like streptococcus or
Yeah.
any bacteria that's on your tongue. I could imagine even like what is that other one that's in that bacteria that could candida, like if you have it even on your tongue or anything like that, it could
Yeah.
be on your skin. It's a hot, moist, dark area.
I never knew how bad my breath was until COVID.
I feel you. I know. You're like, I do not like me right now. I get
Anyway,
it. I totally get it.
I mean, we're giving out a lot of topical antibiotics to people with maskne now. Just topical creams with an antibiotic to calm down the acne because you can't stop wearing it. That's it.
Yes, you can't. And that's like, you can't stop wearing it.
Someone asked earlier about microneedling.
Yes, please.
That's like a hot topic right now. I love microneedling. We do a lot of it in the office, but it's not for everybody. It's really for people who have textural problems of the skin. It's not going to help with pigment. It's not going to help with broken capillaries, and it's not going to like tighten or give you a facelift. So it's a great treatment. It's just, I tell people don't jump on it just because it's the hot thing right now.
Got it. So like what about the at-home microneedling? They can do
Eh,
that. It's like not,
they
it's
could do
not
that.
too, okay. You're
That's
not,
fine.
I
That's
love
fine.
that you're honest about that. You're like, no, keep it behind. Like
Yeah,
move on to, I get it. I
there's
love
something
it.
out there for everything. There's
Let's see.
someone.
Oh, is there a procedure to firm jaw, neck, and lower face? Actually, I would like to know that. Not for myself at this point, but I think my mom would be okay with me saying this. Like she just noticed it's a little different here, like
Yeah.
as she's
Yeah.
aged, and it's nothing too crazy, but what can she do that's like, she's not a procedure girl, but she would do
Yeah.
maybe a
Yeah.
little
Yeah.
something.
Yeah.
What is something that you could do that's not going over the knife? And like you said, you don't do that. You're not a
A
surgeon in
plastic
that
surgeon.
way.
Yeah.
Yeah, but what can people do for jowl
So
and
there are a lot of different devices out there that use radio frequency or ultrasound energy. A very well-known device is called Ultherapy or Thermage, and what they do is they deliver heat into the skin to tighten the skin and increase collagen. So for people with mild to moderate laxity in this area, or even around the eyes or the cheek, you can get tightening. But it can be oversold because there are people, if you have a lot of loose skin, you need surgery. Or you just need to accept the aging process, which is okay too.
right. So I actually looked at all therapy for my mom,
Yeah.
and everyone said that it was so
Painful.
painful. Painful,
Yeah.
like dying, like to the bone,
Yeah.
like
Not you have to be sedated for it. I give laughing gas and pain medicine, and it works
okay.
great.
And what
You,
do you like Real Self by any chance? Because I use that just for like I type in the craziest stuff. I'm like butt implants, uh, boob
yeah,
lift, eyebrow, whatever. I like type in everything. But for Real Self, do you feel
it's
like that's a
good.
good resource, or how would you recommend someone to find the right person?
Yeah, Real Self is a good resource, but people have to remember there's a lot of advertising on Real Self, and the people who advertise get pushed up to the top of the list. So there is a bit of a pay for play action there.
Got it.
I think it's a good way to source original information, and then I really always find word of mouth. You don't have to be embarrassed to talk about these
Yeah.
things. Every one of your friends is going through the same issue, and you could ask somebody and find a doctor.
And
Um,
actually, so many of my friends love you, by the way.
oh,
So
thank you.
many. I've heard about you for forever,
We have a
way
common
before
friend,
I even.
Madlena Kalinova.
Yes, no, I know. And you were at my girlfriend Lindsay. I think she's on here on her wedding. At her wedding,
Yes,
it was in the Hamptons.
yes,
But
yes,
they were
yes.
like, "Oh my God, that's the face guy. That's the you have to go." I was like, you know what? I may check that out. Okay, so let's see. But people absolutely love you. So
Thank you.
it is.
Ooh,
Yeah, you're
pillowcase. I'm
very.
seeing stuff
Oh,
about
ooh,
pillowcase.
thoughts on cool sculpting?
Oh,
Please
yes.
tell me on that.
Okay. So cool sculpting. It is a very effective technology. It does remove fat, but it is overused. It is for people who have small pinchable bulges. Unfortunately, like 30 or 40% of the people I do liposuction on have spent a lot of money and a lot of time and have had a lot of problems with it. So it's for little bulges. That's it. You have to be cautious with
So
it.
is it like somebody that like works out for forever?
Yeah.
They've worked out and then they just can't get rid of a pooch
Yeah.
or a little thing or a.
That's it.
Okay.
It's for like a 3 pound, like you wish you were 2 pounds lighter in this one little area. And
Yeah, it's
listen, a
like
lot.
those treatment resistant
Yeah.
areas that are
Yeah.
just like there's nothing you can do. Like my butt example. No matter how many squats I do, it's just like it's not gonna happen. It
Right.
needs something, it needs that up leveling. And I think
Right.
that for people that are looking at these things that are not movable, let's just say,
Yeah. Yeah. Yeah.
like no matter what I do, that's not going to happen. So I think that's a really good indicator of it. Your chin's not going to grow.
No.
So that's a
Exactly.
good way to
Yeah.
know if that's a good fit for you. I
Yeah.
think is like, okay, well, that is not something that's going to change or whatever. I think that's something where you're like, okay, these hollows, these everything. Those are the little things that I think give the most fulfillment that are
Absolutely.
truly going to make the
Oh
quality
my
of your
God.
life better to
This,
yourself.
this this is exactly what I say. People don't realize you don't have to make drastic changes to get good results.
No,
Little changes in several things in your life
consistently.
make big results.
Yes.
If you
Little
do a
changes, consistency. Yeah,
yeah,
I love that.
people want to do something drastic, and I'm like, don't do anything drastic. That's not you. You have to do little things in several different aspects of your face, of your body, of all these things, and they will add up to something that no one will notice but you.
Oh, interesting. nobody will, because it's for you. A lot of it,
Yeah.
like, I do that for me. It's nobody else is going to notice. Nobody could even, they don't even know what I'm doing. They wouldn't know
Yeah.
any different. But
Yeah.
I do it for me. I'm like, they're like, oh, I didn't even notice that. I'm like, I, and it's a weird thing, because I'm like, oh, I didn't do it for you. I did it because I feel better, even
Yeah.
a
Yeah.
smidge better.
I know.
And if it wasn't, that would have been fine, and I would have been fine.
And then
But I
other
was like,
people read that.
exactly. And that energy. And I think that you really have tapped into the energy of, I feel good about it. I did it for me. And you actually said something about when we're doing it for the standards for the outside world versus for the internal world, like
Yeah.
where that desire is coming from, of the sense of fulfillment. And I think that there really is clear boundaries on where that's
Absolutely.
coming from, and what it is. Is it because is somebody else is getting breast implants and you think that boobs are really in, or is it something where you're like, oh, when I wear dresses I just don't have any projection,
Exactly.
or oh, I
Exactly.
don't have any whatever. Like, there was a comment recently, like, I would love to do a breast lift, but I don't want implants. I don't want
Oh,
implants because
yeah.
I don't like, and it's
I
not
know.
really that great. So
Yeah.
you know, you don't do that because you're like, oh,
Yeah.
what is there? Like, and I have a little bit, but it was one of those things where I'm like, like, yeah, it's just like, I don't want implants. I
Yeah.
would love them to have a little situational
Right.
difference, but it's just not happening for me.
Well, this is what pro-aging is about. It's also about accepting limitations and being
Accept it.
happy.
I'm like,
Yeah, it just like there's some
yep.
things like I can't exercise like I did when I was 20. I'm 50 years old. I have to have the same expectations with what I can do with a needle and a laser. It's okay because in the big
Amen.
picture, you're doing better
It's
than most
okay.
people. You're doing better than most people. You know what I mean? So,
Well, I do always go back. I always go back to this, and I probably shouldn't, but I always go back to, I sustained 2 human beings for 2 years.
yeah.
Like, I gave them so much milk out of there, and I loved it, and it was my favorite part. And I'm like, those boobies did me good. And I remember sitting in front of the mirror the other day. I was like, like,
Oh,
you're okay, girl.
sorry.
Like, it's not perfect by any
Yeah.
means, and
Yeah.
it's not even half of what I
Yeah.
wanted. But I was like, you really served me well, little bubby.
Yeah.
You
They're
did
gonna
good to
keep
me.
draining you. They're gonna keep draining you in many other ways, I promise.
Oh, I'm sure. We've talked about this. Yeah, it just, they
It
up the
doesn't
ante.
stop.
Okay. It doesn't. It just changes.
Yeah.
Okay, let's see. Are there any treatment options? Oh, I don't know how to say the name, but it's that chicken skin underneath your
Oh, crepey
arms
skin.
and on the back of
Yeah.
your legs.
Yeah. The same sort of things that you do for here, you do for there.
Tell me, what for, like, that
The
chicken
old,
skin?
yeah. Oh, you do things like all sort of thing. It's difficult. Some people just have to go get it cut.
Oh, I'm sorry. I think she's talking about the that little, like, it's a dermatological thing. It's like little baby,
Oh, the bumps,
the
the
little,
bumps,
yeah.
the bumps. Okay, that is difficult. It's something that usually people grow out of. It's something that a lot of younger people get. The only thing you could do is regular exfoliation and like cortisone creams. There's no real, teenagers get it. People in their 20s and 30s get it. I always say most people grow out of it, and by the time they grow out of it, they have other issues.
Yeah,
It's
yeah.
it's a genetic thing, and mild exfoliation will help it.
Exfoliation. Yeah, there
Yeah,
was this one brand, and I've used it because I have it on my legs. It's called KP Duddy.
yeah.
Have you heard of that? It's like it's that they really specialize in this particular thing, so I would check that out.
Okay.
Okay, are there any? Okay, hold on. Let's go down here. Oh, this was a really great question. Hold on. She was talking about fillers, and if they hold on. She was asking, oh, this is a good one. Will fillers in the face over a long time make you look older or have pillow face?
Yeah. They will if you abuse them.
Oh,
Absolutely.
tell me
Yeah.
more.
You have to realize there's a difference between inflation and reflation. I want to put things back where they were lost. Once you start overfilling the face, you stretch it, and over time, the skin will become doughy. And that's why some people, if they over
It's the
abuse
same
them,
thing, like, it's kind of like having a belly. You, like, stretch the skin
yes,
and it's not going to go back. It's like your lips are
exactly.
like balloons. If you overfill, you're going to
Yeah,
get that
yeah.
crepiness that a balloon gets.
Yep, that's right. And there are some
Interesting.
people,
Okay, so that's a really Go
There
ahead.
are some people who are not candidates for fillers at all because it'll just make their face round. People think fillers are the answer for everything. They're not. And there are a good 20% of patients that I say fillers aren't for you.
Yeah, good for you. I love you. I love that you're like willing to turn somebody away. So I want to ask you about this because my girlfriend Tara Lowenberg, she introduced me to this guy, Dr. Furshiner,
Love
and
him, Dr. Furshine.
Furshine, sorry.
He's my
I
doctor.
He's amazing.
Yeah.
He's freaking amazing. But what he did for me, and I don't know if you do it at your practice, but he did, instead of a filler, he did PRP with my
Yes.
blood.
Yeah.
And I got it like, I want to say a year and a half ago. It could have been a year ago, but he did that. And he did it here and my face looks
That's great.
like it's really good right here.
That's
And it
great.
was all natural. So I think for someone that is looking for an alternative or a more natural option, this is blood, your own blood, spun in a centrifuge. You get the PRP. They put it in micro droplets on your nasolabial folds or wherever you want it, and you're using your own body's nutrients. So I thought that was
We use
really
it for the
cool.
hair. We use it for hair growth in women too. It works really well for hair.
Interesting.
Yeah, yeah. And
So
Dr. Furshine
he's amazing.
got me through COVID. He's my personal doctor, and he literally saved my life.
He is. I didn't know. I didn't know. I was going to say congratulations, but thank God for Hashem,
exactly.
that you're okay. He is. He's a magician, and that man is light years ahead. I have never. I could stay in his office for 3 hours because what he says and how he says, and he has that whole body approach. Like I remember I went in and I was just like, where has he been all of my life? He can find the crazy, if anybody's having any issues with their gut, if they are having problems with their gut, go see Dr. Furshine.
He diagnosed mercury toxicity on me as well. And like no other doctors could figure out stuff. I mean, I send all of my patients to him for concierge medicine.
He's a rock star with blood. He told me what did I have? It was something really simple. It was like this hormone. Oh, he told me that I do not metabolize B12. I need methylated. So I was taking all of these things and my body wasn't. Me too. I was like crashing. Yeah, and I needed methylated B12 and it was a game changer. I thought I was like getting depressed and I was like, I can't keep my eyes open. And I'm pretty high energy. So I was like, is it this new mom thing? Is this whatever? So I got a panel with him and he's like, no, you need methylated B12. And then I started the products and it was absolutely amazing. So I love him, but he's amazing for PRP. But let's see, spell his name. How do you spell first? I will link it.
Link it up.
I'll link Dr. Furshine because he's amazing. Models, do you have to enhance their what are models doing to enhance their cheekbones? Is it filler? Sorry.
Yeah, they're using a lot of filler. And it concerns me, the over abuse of fillers in models, because my concern is that they're going to be stretched out by the time they're 40. I'm not going to name names, but we all know them.
Yeah, the lips, I just can't do. I can't.
The lip and too much in the cheek, just too much.
Yeah, it's a little wild. Oh, I treat eczema on face and body.
Oh, I mean, listen, it's really all about moisture. People who have eczema, particularly on the face, they have a poor balance of hydration. You know, steam treatments, using thick moisturizers, really avoiding things that exfoliate the skin or irritate the skin. When people see dry skin, they want to exfoliate it. They have to realize that that's the worst thing that they could do for themselves. So they really have to, I always say in my book, keep it simple, stupid. The rule of KISS, less is more in someone who has eczema skin.
It reminds me of, I was reading about how scars, if you should have a dry scar or a wet scar, that you should really keep it moisturized instead of having like what do you, is that
You want,
similar in that? So you don't
yeah,
exfoliate and make it dry.
no, do
You
not
just
do
let it
that.
go.
You let it go. You
You let
just
it go.
moisture. Things heal best in a moist
Great.
environment. Always, always.
That's what I did it. I was looking at a side by side on like a dry scab without moisturizing and then like kind of messing around with it, or just moisturize with a Band-Aid, and it's a big difference. So
I
if
could
you,
I could see you like your dermatology. You're looking up before and afters. You got scar
oh, no, no,
pictures
no,
there.
I'm a creep. No, 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 I'm a creep. I'm really bad with
You're
those.
like you're like
I
scrolling, you
love
know?
I love medicine in
Yeah.
general. I am always like, I could tell you any medicine, any weird antibiotic, any cream, like I find it fascinating. And specifically with cosmetic surgery, or cosmetic anything, I'm very fascinated on what makes it beautiful in terms
Right.
of like, is it a ratio? Is it a
Right.
proportion? Is it a number? Is it a feature? Is it all of those things? And I've just found it to be like, and little children, when they smile at pretty people. Like if they're in, like if a not nice teacher or not particularly beautiful teacher comes to you versus a beautiful teacher, they will be more apt to smile. And
That's
I
true.
find that so fascinating, that it's a human condition for us
Absolutely.
to perceive
Absolutely.
beauty. And you actually said something in there that you said it was neurochemical. What
It
goes
is
on?
neurochemical. We are
Neurochemical.
visual. We are visual. It affects our mood,
So
and
I thought
we respond certain
yeah, I
ways to
thought that
certain
that
things.
was fascinating. So it's kind of like knowing the science of it and knowing your backstory and
Yes.
knowing humanity and
Yeah.
owning that human aspect of yourself, and
Absolutely.
um like adding to little tweaks to that original thing
Yeah.
if you
Yeah.
want, if it, because some people don't
Yeah.
care. People
But you
don't
know
like
what?
it. It depends on what.
The
Yeah.
greatest thing about beauty is that a lot of times you can't tell what it makes someone beautiful, and that has to do with the inner being and the mojo, the demeanor you get from someone, the way they smile, the way they act,
Yeah.
their confidence. And that's why the best thing about beauty is that it's not objective, it's totally subjective, and it equalizes things. And it's funny
And
because
it's
you see
emotional. It's a
it's
vibe too.
emotional.
You're
It's
like, oh my
emotional.
God, there's,
I always say you can't inject a smile. The smile is the biggest form of cosmetic surgery that exists. It
yep,
attracts everybody. And
yep, it's
if you
true.
can get someone to smile, this is why I talk about I have a cosmetic dentist, Dr. Michael Appa, who's in the book, because the smile and the teeth are such an important component to the visual aspects of beauty.
So big.
Yeah.
It's actually, I remember reading something where it was like, if color of teeth, and if your teeth are like jacked up, like if you like are missing a front tooth, it really, you can look at it before and after. Even missing one tooth, it's like you could be
Changes everything.
like you're like going from, I guess the hillbilly to like,
Yeah.
a princess.
Yeah.
And you're
Yeah.
like, wait, how is that possible?
I
So it
know.
is really clear. And even age with this, the color of your teeth, I thought was fascinating. People connote age of, or
Yeah.
color of teeth with age.
Yeah.
I have
And,
no idea if you have a
and
brighter smile.
some people get their teeth so white, they get veneers and it looks so fake and it's just as
Oh
bad as
yeah,
any
no,
form.
I've
It's like chiclets. It's like,
I've
oh,
seen some bad veneers. Okay, someone has a question about their son, and I really want to answer this because this is a good one.
okay.
What do you recommend for a 10-year-old boy that has extremely dry hands? His hands look like a construction worker's. That's how dry they are. Thank you, doctor.
Um,
Aw,
I,
so
I think
cute.
that is cute. It sounds like the son has an allergy to something he's touching. It's not normal for a 10-year-old to have hands that dry. And it's very common to have allergies to things. It could be paints, it could be things in gloves, could be things that you're touching, and it makes it look very, very dry. So I would go to a dermatologist for allergy testing.
Oh, interesting. That's a very, very good one. I want to ask you a personal one before we get off, just because
Okay.
I found something out really, really cool. My mom's writing chiclets. And she
Chiclets.
loves that.
That's right.
She
Chiclets.
loves that. She loves that. So one thing that I had which I didn't know I was having. I recently, and I think it may have been that mask situation.
Yeah.
I suffered 3 weeks ago. I got something called, sorry, I can't remember it. It was a bacterial infection. It's normally in children. It's called, it has yellow crust.
Impetigo.
Impetigo. You got it. There you are, doctor.
I'm a dermatologist. I'm a dermatologist.
Damn it, that was good. Because I really gave you like nothing. So that's exactly what I
You
had.
said yellow crust. Yellow
Yes,
crust.
yellow crust.
Honey,
So I had this
honey colored.
honey color. That's exactly what it looked like. So I had it around my nose,
Yeah.
and I was like, what is going on? What is that? So I figured it out, and then I really think that I had been having. So they say impetigo is a form of streptococcus that
Yes.
is either first in your body and it comes out, or it's secondary. Like you have a pimple and then you get it. So I have an inclination that I started taking antibiotics, and I'm not used to. I don't normally do that. My mom was like very unorthodox and was like, okay, you can cure yourself. But I was like, okay, with this thing, I can't. It's contagious. I don't want to hurt my kids. So I treated it. In the meantime, while I treated this infection, the rest of my skin cleared up.
Yeah.
Here. So I think maybe this whole time I had been having an overgrowth of the strep bacteria inside my body.
Absolutely.
That this had been coming up like every couple weeks. So please tell me. So anything that you...
Yeah. Another type of strep is found naturally in your skin and causes acne and pore size changes. So which is why when people have bad acne, we often give antibiotics that would not only treat the acne, but would probably cover your impetigo. So it's not uncommon when you take antibiotics that it clears your skin. Plus, antibiotics not only treat bacteria, they are anti-inflammatory. We sometimes put people on low-dose chronic antibiotics just for inflammation. So that's exactly why.
No, thank you so much. So is the difference, so I have been using the cream, the antibiotic cream. Is that something that you can do like consistently, or is that just as strong as if you were taking an oral?
It's not just as strong, but we often, and it's safe to use just topically because you don't want to take pills, antibiotics forever.
Absolutely.
You know what I mean? But there are a lot of people who have difficult skin who I keep on them a topical regimen indefinitely of antibiotic.
Okay, got it. I cannot wait to come into you. I do not know if you're out east at all, but I am gonna. I want you. I'm gonna have you like zap and do everything. I want you to work your magic on me and just make me look amazing. But
well, I think you're beautiful inside and out.
Thank you. Thank you. Thank you. Same. We are like two peas in a pod, and this was freaking awesome. Thank you so much. I love your book. I will swipe up to his book, but thank you so much. And I'll be seeing you soon. I'm going to be coming into you. All right. Bye, babe. Bye, y'all.